Deep understanding of diabetes. Diabetes is a chronic condition characterized by high levels of glucose, sugar, in the blood. It is caused by problems with the hormone insulin, which is produced by the pancreas and helps to regulate blood sugar levels. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes is an autoimmune condition in which the immune system attacks and destroys the cells in the pancreas that produce insulin. This type of diabetes usually develops in childhood or adolescence, although it can occur at any age. People with type 1 diabetes require insulin therapy to manage their blood sugar levels. Type 2 diabetes is the most common form of diabetes and is caused by a combination of genetic and lifestyle factors. In this type of diabetes, the body becomes resistant to insulin, and the pancreas may not produce enough insulin to compensate for this resistance. Type 2 diabetes can often be managed through lifestyle changes such as diet and exercise, although some people may also require medications or insulin therapy. In addition to type 1 and type 2 diabetes, there are other forms of diabetes, such as gestational diabetes, which occurs during pregnancy, and monogenic diabetes, which is caused by a single gene mutation. Complications of diabetes can include damage to the eyes, kidneys, nerves, and blood vessels, as well as an increased risk of heart disease, stroke, and other health problems. Proper management of diabetes, including monitoring blood sugar levels, taking medications as prescribed, and making lifestyle changes, can help to prevent or delay these complications. There are several important factors that contribute to the development of diabetes. 1. Genetics. A family history of diabetes can increase an individual's risk of developing the condition. 2. Obesity. Being overweight or obese is a major risk factor for type 2 diabetes. 3. Sedentary lifestyle. Lack of physical activity can increase the risk of developing type 2 diabetes. 4. Unhealthy diet. A diet high in processed foods, sugar, and saturated fats can increase the risk of type 2 diabetes. 5. Age. The risk of type 2 diabetes increases as people get older. 6. Ethnicity. Certain ethnic groups, such as African Americans, Hispanics, and Native Americans, have a higher risk of developing type 2 diabetes. 7. Gestational diabetes. Women who develop gestational diabetes during pregnancy have an increased risk of developing type 2 diabetes later in life. 8. Autoimmune factors. In type 1 diabetes, the immune system attacks and destroys the cells in the pancreas that produce insulin. 9. Pancreatic disease or injury. Damage to the pancreas, such as from chronic pancreatitis or trauma, can impair insulin production and increase the risk of diabetes. 10. Medications. Certain medications, such as corticosteroids, can increase the risk of developing diabetes. How to overcome diabetes? What are the steps needed to follow? 1. Managing diabetes can be challenging, but there are several steps that people with diabetes can take to help control their blood sugar levels and reduce the risk of complications. 2. Monitor blood sugar levels. Checking blood sugar levels regularly is essential for managing diabetes. People with diabetes should work with their healthcare team to determine how often they need to check their blood sugar levels and what their target levels should be. 3. Take medications as prescribed. People with type 1 diabetes require insulin therapy to manage their blood sugar levels, while people with type 2 diabetes may need medications such as metformin, sulfonylureas, or insulin. It is important to take these medications as prescribed by a healthcare provider. 4. Follow a healthy diet. A balanced diet that includes plenty of fruits, vegetables, whole grains, and lean protein can help control blood sugar levels. It is also important to limit processed foods, sugar, and saturated fats. 5. Get regular exercise. Physical activity can help improve insulin sensitivity and lower blood sugar levels. Aim for at least 150 minutes of moderate intensity exercise per week, or as recommended by a healthcare provider. 6. Manage stress. Stress can affect blood sugar levels, so finding healthy ways to manage stress, such as meditation, yoga, or deep breathing exercises, is important. 7. Maintain a healthy weight. Losing weight and maintaining a healthy weight can help improve insulin sensitivity and lower blood sugar levels. 8. Quit smoking. Smoking can increase the risk of complications in people with diabetes, so quitting smoking is important. 9. Get regular checkups. Regular checkups with a healthcare provider can help detect and manage any complications related to diabetes, such as high blood pressure, high cholesterol, or kidney damage. By following these steps and working closely with a healthcare provider, people with diabetes can help manage their condition and reduce the risk of complications.